Thanks for choosing Icing for your new earlobe or ear cartilage piercing. You're now part of the over 90 million piercings our specialists have performed worldwide. Before your piercing, our associate should have taken some time with you to be sure you understood what was going to happen during the piercing process and reviewed our aftercare procedures on a sheet for you to take home. Even if you've had your ears pierced before, it's really important that you understand and follow our recommendations about the best way to take care of your new piercing until it is healed completely. So, we're going to take you through the steps to clean your new piercing and tell you about a few things you should be aware of. To begin, remember that your piercing earrings should not be taken out until the ears are completely healed. This is 6 to 8 weeks for an earlobe piercing and 8 to 12 weeks for an ear cartilage piercing. Before cleaning begins, it is very important that you thoroughly wash your hands with an antibacterial soap. Also, try not to touch the new piercing unless it's time to clean your ears. The front and back of the new piercing needs to be cleaned with the ear care solution that came with your piercing at least 3 times a day. Using a saturated cotton ball or cotton swab, apply the ear care solution to the piercing. Slide the earrings back and forth in your ear so the solution will get inside the piercing. Then, holding the earring from the front, gently rotate a few partial turns, both forward and backward. At this time, check to make sure the clutch back is securely positioned in the safety notch. The earring back should never be flush against the ear. Be careful not to remove the earring. Remember, you'll need to clean your piercing at least 3 times a day. You might want to do this once in the morning after you're done taking a shower or washing your hair, again after school or work, and once more before bed. Here are some additional points that you need to be aware of so that your piercing will heal successfully. Hair can easily get wound around the post of the earring, so be sure that you watch for that. In fact, if you have longer hair, you might want to keep it up and away from your piercing while it's healing. Be careful to keep hairspray, shampoo, cosmetics, perfumes, sunscreen, or any other personal care products away from your newly pierced ears. If you have used any of these products, or you've been exercising, swimming, or in a hot tub, clean your ears with the ear care solution, as mentioned before. Be extra careful when putting on or taking off clothing over your head, brushing your hair, sleeping, wearing headphones or headsets, or even talking on the phone so that your newly pierced ears don't get irritated. It's important to know that there are some issues that could become serious if you don't react to them, so please listen to this next section carefully. If you've had your earlobes pierced and you're experiencing any pain, redness, or swelling that exists for more than 24 hours after a piercing, this is not a normal result of earlobe piercing. You should contact your doctor. On the other hand, if your ear cartilage has been pierced and you're seeing any redness or swelling for more than 24 hours, our recommendation is to immediately remove the earring and see your doctor. Ear cartilage piercing carries a greater chance of a serious infection, along with other risks. You should also be aware that ear piercing earrings that are too tight can cause embeddings and infection. An embedded piercing looks like the earring is beginning to disappear into the ear and the surrounding area is swollen and red. To help avoid this, make sure the clutch back doesn't move past the safety notch on the post of the earring. The earring should never be flush against the ear. If the clutch back does move past the safety notch, the ear may be squeezed between the front and the back of the earring, which can cause embeddings. Each time you clean your ear, remember to look for any signs of embedding, swelling, infection, or redness. If you see any of these signs of trouble, be sure to talk to your doctor right away. The last thing we want to remind you about is the amount of time you'll need for your earlobe piercing or ear cartilage piercing to heal. If you've had your earlobes pierced, the ear piercing earrings should stay in for at least 6 weeks. Then you can remove the piercing earrings and insert other post-style earrings. Post-style earrings should be worn for at least 6 months, or the new piercing might get smaller or even close completely. If your ear cartilage was pierced, the piercing earring should stay in for 8 to 12 weeks. Then the earring can be removed and a post-style earring should be worn for the first 12 months to ensure your ear cartilage piercing remains the proper size. Well, that's all there is to it. By following these simple steps, you'll be on your way to a healthy and successful healing process for your new earlobe or ear cartilage piercing. All of this information and more is on the aftercare sheet provided with your piercing, and it can also be found on our website along with the latest trends in jewelry and accessories. Congratulations on getting your earlobe or ear cartilage pierced at Icing. We look forward to seeing you again soon.